Hello, I'm Betty Casey. I'm editor of TulsaKids magazine, and we've partnered with the Children's Hospital at St. Francis to bring you information about children's health. And today I'm welcoming Dr. Mark Schwartz, and we're going to talk about scoliosis. Dr. Schwartz is a pediatric orthopedic surgeon with Warren Clinic. His office is located in the Warren Clinic Tower at 66th and Yale. He attended medical school at the Kansas City University of Medicine and Biosciences. His residency was at OSU Center for Health Services, and he completed a fellowship at Cincinnati Children's Hospital Medical Center. So welcome, Dr. Schwartz.
Thank you very much.
All right. So scoliosis, let's just start with the beginning. What is it and how is it diagnosed?
So scoliosis is any abnormal curvature of the spine that typically will get diagnosed during childhood and into adolescence. It's most commonly seen in adolescence, but occasionally we will see it in younger children, at which point we call it early onset scoliosis. But the majority of the cases that we see are usually in younger adolescents, where it gets picked up on either at a child check, or some schools will still do scoliosis screenings, and it will be found on those exams. Typically it's diagnosed with a physical exam, and then if there are positive physical exam findings, we can diagnose it further using X-ray.
So it's not a congenital, I don't know what to call it, diagnosis. It's something that happens later when they're
so
adolescent?
there are different kinds of scoliosis. So there is a congenital kind of scoliosis where there can be abnormalities within the vertebrae when a child is born, that can lead to a scoliosis curve as they're growing because of those deformities within the spine. Those are more rare than the idiopathic type, as we call it, which we don't have a full understanding yet of what exactly causes it. We're fairly certain that it has to do with genetics, but that's all still being researched at this point, trying to figure out exactly what causes those cases that form as kids grow, as opposed to being the ones that are there when they're born.
Okay. So typically then a diagnosis would happen in early adolescence. Is that correct?
The majority of the diagnosis occur in early adolescence. Occasionally they get found later on, but the majority of scoliosis tends to grow and develop and become bigger as kids are going through growth spurts. So they tend to be found more often in that early adolescent phase.
Okay. And what are the treatment options for an adolescent or a child with scoliosis?
So our standard treatment options for mild curvatures is just observation. We tend to see these kids back about every 6 months to get new x-rays to ensure that their curve is not getting bigger. If a curve has got beyond that mild diagnosis into more of a moderate curvature, we treat those with special type of bracing. So we get kids placed into a custom brace that's made specifically for them to try to hold their curve. Unfortunately, the braces don't make the curve go away, but we try and hold their curve as they're continuing to grow to try to prevent the curve from getting bigger as they go through their growth spurts. Beyond that, if bracing hasn't worked, or if their diagnosis isn't made until the curve is more severe, surgery becomes the option to take care of the bigger curves. We know that bigger curves tend to continue to grow and progress throughout life if the curve is too big by the time they're done growing. Curves that stay below 50 degrees tend not to continue to grow throughout life, so typically won't need any further treatment once they're done growing. So our goal with the observation and bracing is to try to keep them with a small or mild to moderate curve up till the point where they're done growing. And once they're done growing, if their curve has stayed below that 50 degrees, usually they're going to be okay throughout life and not have any problems with it. But if that curve gets over 50 degrees, those are the curves that continue to progress throughout life and cause problems later on. So those are the ones that we'll tend to treat surgically.
what kinds of problems do first adolescents that may have this milder curvature, what kinds of problems might they have, and what kinds of problems does a more severe curvature create throughout life?
So the mild curvatures don't tend to have any significant problems. We don't think of scoliosis as a painful condition. In the more mild curves, the incidence of back pain in children with scoliosis that's mild is about the same incidence of back pain in kids that don't have scoliosis. So we don't feel like the scoliosis is actually causing them any pain. Now, that's not to say some kids with scoliosis don't have back pain, but we also see kids that have back pain that don't have any scoliosis. So usually the mild curves, they don't really have any problems. They're able to continue to participate in all activities and continue to play sports and do all the activities that they like to do. Kids with more severe scoliosis also tend not to have any significant problems, as long as we're catching those curves earlier on before they're really severe. And that's why we try and take care of those earlier. It's usually later on, as those curves continue to progress, if nothing is done about them, that it can start to cause further problems. It can cause problems with heart function and lung function, and also causes them deformity of their bodies, and potentially pain also with those larger curves.
So it sounds really important to have this diagnosed early on so it can be treated earlier rather than later. What signs should parents look for in their child?
So absolutely right. The earlier that we're able to diagnose and catch these curves, the better chance we have of preventing a kid from needing surgery and going on to that type of treatment option. Typically, these are found on well child checks. So one of the most important things for parents is to have their kids getting their normal yearly well child checks with their pediatrician or with their family docs. Those screenings usually will find them. It used to be much more common that the screenings were done in schools. They're done less often in schools nowadays, usually just because of funding and availability of school nurses to be able to perform these screenings. Things parents can look for, they can sometimes see it. A lot of times it gets found in the summertime. Their kids put on their bathing suit and go swimming, and they look at them and they see their back, and they notice that the back just doesn't look straight. And a lot of them that come and see me are found that way. Other things they can look for, sometimes we see asymmetry of the shoulders or the waistline. Sometimes of the shoulder blades, they sometimes have a little bit of a rib hump that sticks out on one side over the other, because the scoliosis isn't just a curvature of the spine, but it also has some rotational deformity with it as well that sometimes shows up, and it looks like they have bigger muscles on one side as opposed to the other, but that's really just the rotation of the rib cage that's attached to the spine.
Is there anything that can be done to prevent scoliosis?
So there's nothing specific at this point that we can do to prevent scoliosis. We have our treatments with bracing to be able to prevent scoliosis from getting worse and becoming a bigger curve that would necessitate surgery. But at this point, unfortunately, we don't have any treatments yet to be able to prevent scoliosis altogether. Hopefully someday the research will find some sort of genetic treatment where we'll be able to do something for this earlier on to prevent it from actually happening.
Okay, so really that early, making sure that we get our kids to the doctor every year, get those well child visits, sounds really important. Can you talk to us a little bit about general spine health, especially since, we're hearing a lot about spine and neck issues related to kids and adults leaning over our computers, over our laptops, over our tablets for long periods. Do you see any problems related to that? And obviously, what can we do about that?
Yeah, so we definitely see problems from that. We see it's different than the scoliosis. So kids leaning over their video games and laptops and phones and all of that isn't going to lead kids to develop scoliosis. The scoliosis is something that likely is happening their genetics or from something else. It's not happening from anything that they're specifically doing. Heavy backpacks, things like that are not causing scoliosis. We get a lot of parents that are concerned that their kids' backpacks are overly heavy at this point, which isn't something that's going to cause them to develop a scoliosis. But we see more and more kids that are coming in with back and neck pain that are having some of these issues because of their poor posture and their constant sitting over computers and video games and not getting out and getting the exercise that would help them, and just sitting in poor posture, which can lead them to develop back pain and have issues with that later on, but not so much with the scoliosis.
Okay, so do you have any other tips for parents or advice from parents about scoliosis or about back and neck related pain?
Yes, so I think it's very important that the parents are taking their kids for their yearly checkups, and it's something that they can bring up with their pediatrician. If it's something that they're noticing the pediatrician doesn't seem to be checking for, they can ask the pediatrician if it's something that they check for. I think the majority of the pediatricians are doing a great job with it, and the family docs are doing a great job with it, and they're finding these kids early, and they're getting them into us early to be seen, so that we can either observe them and follow them over time as they grow, or at least or get them into a brace if they have bigger curves. So I think the parents getting them in for these screening visits is very important, along with just their general health, because yes, the earlier that we find these patients with scoliosis, the better our treatment options are and the better outcomes that we tend to have. In terms of general spine health, I think it's very important that kids are being active and that they're getting outside and doing other activities more than just sitting inside and playing video games when they're getting overweight, which we see a lot here in our country and especially here in Oklahoma. Having extra weight on can definitely affect overall spine health. So trying to keep kids active and keep them healthy is very important for spine health, and trying to have kids pay more attention to their posture and not be sitting in the weird positions they sometimes sit in, to sit over their phones and their computers and tablets all day long. So I think it's important for keeping them away from the screens for some part of the day, at least, to be getting active and keep their backs nice and strong, and keep them from being in a poor posture position all day long, which they probably do a lot of at school.
Right, yeah, to bend the other way and build those muscles, I think. Yeah. So the little mom annoying things like stand up straight, that's that's not terribly horrible, I guess.
Yeah.
For us to say. All right. Well, thank you, Dr. Schwartz. I appreciate you taking the time to educate us. I know I learned a lot about that. I had no idea that scoliosis really was more of an early adolescence problem. So I appreciate that. And I want to thank the Children's Hospital at St. Francis for helping bring you this information. And you can find this interview, the complete interview, and others in PJ's Corner in Tulsa Kids Magazine or at TulsaKids.com. And we'll have the video up, as well as a written version that you can read on our website, so that you can have all of this great information. So thank you, Dr. Schwartz.
Thank you very much.